First of all, I want to emphasize, even though prostate cancer is one of the most common cancers people get diagnosed with, fortunately, especially in United States, fortunately, it is not the deadliest. The reason it is the second most common cause of death in the United States, it's because of its prevalence. If there's one thing I want you to remember when you walk out of this consultation here today, is for you to understand that you are going to live for many years to come. You are going to live for many years to come because of the nature of this disease. This disease is a slow-growing disease, and that's why it takes many years for men to run into trouble from it. Before the advent of a test called PSA in 1970s, men would go for many years before they were diagnosed with this cancer. With the advent of this test PSA, it brings our attention. It raises a red flag. It tells us there is something wrong with the prostate, and we look into it a little bit more carefully. This test came about because of the movement for prevention. Unfortunately, we haven't come out with really key preventative steps. There have been things that can prevent prostate cancer from happening, diet-related, lycopene, vitamin D, vitamin E, selenium, but unfortunately nothing has been a home run. Family history sometimes increases men's risk of developing prostate cancer. Some argue previous infection, previous surgeries may increase the risk of prostate cancer. But the things that have been proven for a fact is the first-degree relative family risk that increases men's risk of prostate cancer. And in terms of dietary guidelines, diets high in fat has been correlated with this. Once one gets diagnosed with prostate cancer, we want to know how advanced the disease is. Just like other types of cancer, nothing comes in the same size fit all. They all come in different severities and form, but fortunately, because of screening and PSA testing, we are finding prostate cancer at an earlier stage, and in those early stage cancers, we can treat cancers with much more success, and the outcome is usually bright. So if there's one thing, again, emphasizing, you walk away from this consultation or the video you're watching, you're going to do fine for years to come. There are many factors that goes on into the equation to tell us how advanced someone's prostate cancer is. Number one is the PSA. We artificially divide PSAs between different levels, 10 and below, 10 to 20, 20 and above. If you happen to fall in the category of 10 and below, that's usually a very good sign, a good factor. Usually no further tests, including a bone scan or CAT scan or MRI scan, is required. There are certain circumstances that your doctor may recommend that, but it's usually not the norm. Between 10 to 20 and 20 and above, the risk of disease going outside of the area where it originated, which is the prostate, it increases. The second factor that goes into the equation is the clinical staging that the doctor gives you at the time of examination of the prostate. It can be as low as a stage 1, as high as a stage 4. Stage 1 means we found it because of a testing that we were doing. We were doing an unrelated test, and we found out that you had prostate cancer. Stage 2 is if we do feel an abnormality on a digital rectal examination on the prostate, and it sort of tells us that the disease is confined to the prostate and has not spread outside of the prostate. Stage 3 is if we feel the disease go into the organs in the vicinity just outside of the capsule. One of the organs is seminal vesicle or just pushing outside of the capsule. Stage 4 is when it's involving organs outside of the prostate. If you happen to be on stage 2, which is 80% of the cases that we examine, that's also a favorable factor. The other key thing that goes into the equation is the Gleason score. Gleason score tells us about the pathology of the disease, how advanced the disease is, and what degree of badness the disease is demonstrating. Gleason score tells us the behavior of the cancer cells. Let me use an analogy. Imagine prostate cells as well-behaved kids that are sitting in a classroom. They're following orders, following the rules, and they're doing the right thing. They are normal prostate cells. They're sitting down and behaving fine. The ones that become cancerous are the ones that are jumping around, trashing the walls and the windows, and causing damage in the classroom, still respecting the boundaries of the classroom and confined to the classroom. Those are Gleason score 2 through 6. Gleason score 7 becomes more chaotically behaving. They penetrate outside of the door, and they go out and they are causing mess throughout the whole school. Gleason score 8, 9, and 10, very aggressively behaving. They are penetrating outside of the walls of the school, and they're tearing down the fences, and they have a high chance of metastasis or going outside of the prostate. Again, let's rewind back. Gleason scores go from 2 to 10. Gleason scores 2 through 6, the ones that are within the classroom, respecting the boundaries of the classroom, they're well behaved. If you fit in this category, that's a good sign. Gleason score 7, penetrate outside of the classroom, still respecting the boundaries of the school. That means they are less well behaved, however, they're not the most aggressive. Gleason score 8, 9, and 10, very aggressively behaving, and that puts you in a certain category which is a little bit more advanced, and different approaches needs to be taken for those cancers. Other things called Psa velocity or doubling time or the volume of the disease involved, they're a little bit more in detail. Basically, more volume of the disease involved, lesser chance your disease is going to behave nicely. And if the PSA is doubling and rising quite fast, it tells us the disease is behaving a little bit more aggressively. Depending on the age that you have at the time you were diagnosed with cancer, depending on your other medical conditions you have, that goes into the equation to tell us how best we can approach and how best we can treat you. If you don't have too many comorbidities, other medical problems that are gonna do in your life before the prostate cancer, then you should get treated for prostate cancer aggressively. Because if you're a young guy in your 50s and 60s, you're going to do just fine for years to come if you don't have too much more medical problems. You should choose modalities that can offer you cure for long term. If your life expectancy is less than 10 years, between 5 to 10, you have to take those recommendations into equation and decide if it is the right approach for you. But if your life expectancy is less than 5, for majority of the cases, something called active surveillance, in the old days we used to call it watchful waiting, may be a right approach, or hormonal therapy. Watchful waiting or active surveillance, basically what it says is, I know I have prostate cancer, but I know it's a slow-growing disease, and it's not the disease that's going to do me in. So let me just watch it, and I see how it behaves. And if it behaves adversely, then I'll decide to see what's the best way of dealing with it. Hormonal therapies, if you don't feel comfortable doing a watchful waiting or active surveillance method, you can slow down the disease progression. So if the disease is progressing at this pace, you want to slow it down so it goes at a slower pace. It takes longer time before it reaches a level to make you run into trouble. Unfortunately, hormones, like any other modality of treatment, has side effects. The side effects from the hormonal therapy will be suppression of your male hormone. What that means is you're going to become more girl-like. Your breast can enlarge. It has an adverse effect on your bone. You can have hot flashes like women do, and you become more sensitive. In the old days, the way we dealt with this was surgically removing the testicles. Nowadays, it's not politically correct and acceptable because it has some adverse emotional effects. So medically, we can do that. With hormones, we inject, we can take away male hormone, and that sort of slows down the fire from spreading, fire being the cancer. But like I said before, it has adverse side effects. The other big adverse side effect is it has a very bad side effect in terms of your sexual performance. Not only your sexual performance will go down,